Now, good morning. Today is a week 3 sessions, and so far I only received one question regarding to concept we discussed. So here we try to sharing and with everybody have a look. Maybe we have some new ideas for answer these questions. Morning, everyone. So the question is, how does the pathogens affect the pericardiums in sanjiao series? We discussed in upper jiao identifications if unresolved heat in the lung could affect pericardium. And here's a part of points I put in the slides. Just have a look. Any suggestions or any doubt or any disagreement or some different ideas for the answers. We all know pericardium located in upper jiao, so does the lung and the heart. Because the pericardium is outside memories of the heart, usually they take the heart to accept any kind of attack or blame from outside. So if any kind of pathogen affect upper jiao, and no matter lung or other part of organs, all these adjuvant zangfu will be aware. It's similar like your neighbors had accidentally, had a fire happen in their house. As a kind of neighbor, by seeing this kind of exuberant fires and burning their property, are you scared or you relaxed? So same for the pericardium. When the lung has been affected by external pathogenic factors, damp heat, if the heat is dominated, if this kind of damp heat pathogens cannot be resolved on time, as kind of fire element, which is very easy attractive the heat. So when the mind, the spirit has been affected or altered, presented as a kind of high temperature, at the same time unconsciousness, muddled speech, or delirious speech, and we call that pericardium has been affected from unresolved damp heat in the lung. If any of you have concerns, have different agreement or different suggestions, and welcome to help to clarify these issues for the questions. Okay, any suggestions for the questions or answers in regard to a few of the points? Does it make sense? Thank you, Nicole. Okay, thank you. So most of you or people respond to my questions and agreed with the points presented on the slides. So we always utilize TCM and theory. So basically checking the 5 element. Pericardium is a 5 element, which attractive fire. We know that one. Second is location. Pericardium located in upper jiao. Yes, they are neighboring adjuvant zangfu organs. And number 3 is if clinically presented spirit or the mind has been disturbed with this kind of unconsciousness and convulsions, delirious speech, and muddled speech, we know Shen has been disturbed. And then therefore we call that pericardium has been affected. Okay, if there's no more questions, and let's have a look. The second part, I want to have a very quick discuss with everybody. Remember we discussed 2 tongue images last week, haven't we? Here I have another one. I borrowed it from online. Just have to make it bigger. Some of you maybe see that last term during the clinic sessions, which is shared by one of our students. Now, if you see a patient or see a person have this kind of tongue, what reminds you regarding to, based on TCM understanding, how we should interpret nature or quality of this kind of tongue? So checking the spirit, checking the qi, checking the jing essence, what this tongue tells us about the quality of the personal constitution and possible the other issues involved. Or does this tongue is quite often representing wounding patterns or not? In which stage? Can everybody see the tongue here? Oh, sorry. Yeah, okay, good. Good. It's a yin stage. And there are some levels, there are some features tells us, and they don't have sufficient tongue coating cover, and such as this area don't have sufficient tongue coating cover, and also they have a lot of multiple cracks. But there are very, very thin tongue coating and covered in these areas. They still have a thin tongue coating covered here. It's a gray-white color with multiple tiny cracks. Yes, it is very, very thin tongue coating. But with such extension stretch, you can see a lot of multiple horizontal cracks in the center of the tongue. Now, any of you see bulging and individual enlarged taste around the tip and the edge? Yes, excellent. Any of you see uneven surface presented on this tongue? Asymmetric or presentation of the tongue? Wonderful, good. So for this tongue, you can see a lot of, we call that rumpy surface. Looks swollen in the center towards the left. Excellent. So this part, these areas looks like a little bit raised up. But whole tongue does not show very good symmetric in the size. We can see the whole tongue, central lines like that, or like this. So this is typical from the qi dynamics. We know that this asymmetrical tongue body is typical liver's qi stagnation, has been present in the body for a long time, result some yin deficiency. Now, which level is yin deficiency dominated? Excuse me. Because the frontal upper jiao regions and the liver, heart, lung regions does not have sufficient tongue coating. So that means major yin deficiency will be dominated by checking liver, heart, lung areas. So this part dominant with insufficient yin. And also they have very, very unhealthy digestions here. A lot of dehydration associated with multiple cracks in the center, horizontal, very fine crack, and also enlarged taste buds around the edge and the tip of the tongue. With two major lines, you can see here, the big dent here, and colored with middle lines here, and a huge dent here, and a little bit big dent around these regions. So lots of indeficiency. But if you remember, we mentioned rumpy surface, more bumpy surface is related with what? A symmetric tongue body, a symmetric distribution tongue coating is result of liver's qi stagnations. With a bumpy surface is due to long-term liver qi stagnation resulting congesting heat, because overall tongue body and have inclinations to the yin deficiency. So this tongue shows a lot of liver qi stagnation caused of congest emotional heat internally. That's why damage the body fluid yin, especially presented in the liver, heart, and the lung regions. How do you understanding the nature, or we call that the muscle tone of this tongue? Do you think the muscle tone looks very firm, strong for you, or could be a little bit loose or flaccid? Looks a bit flappy. Excellent. So this kind of presentation of tongue tells you muscle tones on the tongue body is not strong enough, could represent it with a body have very, very weak spleens qi. So muscle tone present on the tongue is correspond with generally muscle tone for the body, especially middle jiao spleens qi. With this long stretching and flaccid tongue body, and also represented person have to be very tall and skinny body type. By looking at his structure or presentation of his face and chin, you know he had very narrowed chin. So lower jiao does not have very strong structures. So that's why somebody, and in the many messages ahead, mentioned the kidney insufficiency. Yes, I agree with that. From tongue itself does not show kidney deficiency, but from the presentation of his face, and this kind of face is kind of common and inclined to the insufficient kidney water. So that means this kind of person had much more commonly centered imbalance between heart fire and the kidney water. The tongue presentations represent typical insufficiency already presented in upper jiao, at the same time also associated with spleens qi deficiency in the middle. So person or people like this have very skinny, thin, tall body size, and they do not have very strong muscle tone unless they're doing some muscle and body training to build up muscle tone, or to do some specific exercise to build up the muscle tones. And then maybe one day the tongue muscle tone will be altered. There is a question. What do you mean by yin deficiency phase? Okay. Let's have a bit drawing here. When people shows very, very narrow the chin, what does that mean for you? I mean, for the face, not for the tongue. So if upper part of frontal much more greater, bigger than the chin, this usually indicated they do not have a strong yang ming here. Do we remember yang ming's distributions around the face, the channel distribution on the face? Do you know the distributions? Yes? Good. So usually they correlate with insufficient yang ming's qi. But based on the microsystems, the qin corresponds to the lower jiao of the kidney. So this, I hope, can help answer the question about yin deficiency. Now, what's the difference between this tongue and the previous two tongues we discussed in the previous two tongues we discussed session? First one is reasonable, narrow and smaller, have more tender nature. Second is more fat and big and with teeth marks. But this one is something different. They may do not have noticeable, they still have teeth marks, but not as noticeable as the second tongue we discussed last session. Instead, these have very, very long, overstretched and flaccid tongue body. This still means spleens qi deficiency in TCM. So that's what I want to compare this tongue with previous two tongues discussed in last sessions. That's my purpose. Now, if you have very good vision, can carefully check a little bit tinge color change around here. Can you see this? I'm going to clean it. Can you see a bit color tinge change here? If it do represent like this, a bit dull color around here, and then you need to check sublingual vein carefully. So let's have a look if we can find it or not. And there is not. Sorry. Okay, here. And we all see this sublingual vein here. Purple gray, so very, very purple, a little bit enlarged. I believe he's about in 30s or something age, if my memory is okay, but nearly covered the whole range of the sublingual vein. Sublingual vein for microsystems involved upper jiao, middle jiao, lower jiao. So that means this vein covered how many jiao here? All the triple burner has been covered. What that tells us? If you check yourself, the tongue in front mirror in the morning and before, your sublingual vein has been covered all the regions. That means your body is very sluggish. You don't have sufficient oxygen saturating your bloodstream. Thank you very much. It is blood stagnation in all the burner. And from the modern research, they find if people does have enlarged sublingual vein, but this one's not as severe, if it's also twisted, if also looks twisted, if sublingual vein looks also twisted and very bad bulging underneath the tongue, and they have high chances of suffering stroke or blood clots in the brain. Okay, that's all for this little thing. Any questions? If there's no questions, then let's have a look at today's concept. How about the side? What about the side? So what's the question? What about the side? Can you elaborate your question a bit more clear? What about the side? Side of the tongue, something. Side of the tongue indicate its liver blood deficiency. The color, from the color, you can see the patient does not have a strong good blood. Here. Oh, sorry, it's funny. Why did it become like that? Yes, slightly pink paler. So there's lack of blood deficiency, and also very shining and tender. You're right, very tender, very shining, a little bit paler. They have blood deficiency as well. And if you can see this crack here, distributing like this. Can you see that? Any of you can see that? Yeah, good. So this is severe damage. It's a good question. It's severe damage of the liver yin and liver blood. So if this happened like this, we'll ask, is the patient heavy smoking in the past, using medications, or taking recreational substances? So this kind of oblique distributions of the cracks indicate quite a severe and substance injury in the associated organ, which is the liver. Thank you. It's very good. All right, that's all for the tongue. And let's have a look at today's required information for the session. Okay. Now we keep discuss well-being contents for the week 3. Today we'll focus on the treatment method and cover the four in the blackboard. So by checking these slides, you can see the 10 basic treatment method has been mentioned to apply different stage of well-being treatment. In the earlier stage, we're using diaphoretic, so apply the cooling, aromatic herbs to enhance perspiration, clear the exterior attack. When I go to the chi levels, we're using pungent cooling one to vent the heat to the upper level, or cold pungent sweet, at the same time clear heat, and also supply the yin. And also you can apply the harmonizing method if there's mixed symptoms related to cold and heat deficiency and excessive. And number 4 mentioned using dispersed dampness by apply bitter cold herbs with aromatic, moving the qi to transform the damp. Number 5, using purge, bitter cold to dry the damp and heat simultaneously equal in ratios or maybe heat dominated. Number 6 mentioned to using cold bit salty sweet to create heat nutritive level and minimize body fluid injury. Number 7 mentioned using cooling method and apply the salty, sweet, cold bitter herbs to clear the heat in the blood level. Usually number 7 and number 6 has been applied simultaneously because it's not They don't have very clear distinctions regarding to the treatment method. Doesn't matter they have bleeding or not, but you still could use a similar method to deal with similar method of treatment in the clinical practice. But when the bleeding has been presented, stop bleeding become very important and very important important treatment to avoid further leakage of Jing essence. If spirit has been affected and orifice has been blockage, we need using open orifice method and cool aromatic. If any kind of convulsion, abnormal shaking, we're using a method to dealing with the wind. If in the later stage and body get very, very serious dehydrated, we apply method to enrich the yin. And any kind of abnormal disorder, secure abandon disorder, and this can be used as well. So theoretically, they can all be possibly presented. And in reality, we're still using tailored method based on differential diagnosis for individual case. And this is very, very familiar to most of us. We learned formula, we learned internal med, and some of us also learned classics 1. So this is basic for what condition? For wind heat in the early stage of superficial upper jiao or lung systems. And then they have dried cough, itchiness as dominated. We use sanjiao if they have sore throat, fever, swollen glands, and some even skin rashes comes out. We're using yin qiao san. So that's all. That's very simple. And second is talking about specific treatment in Wenbing, vent the exterior and resolve summer heat. So if there's accumulated summer heat, so that means this formula mainly used in the summer season, with attack of a cold trapped in the collaterals. So cold, you can see under the summer heat influence, cold trapped in the collaterals of muscle, present as headache, a whole body discomfort, aching or pain, and slightly soreness, may have fever, absent sweating, thirsty. So there's a mix of damp and cold, and then we're using yin. These are very gentle aromatic herbs and composed by specific xiangru. It's good to vent the summer heat out and resulting or very gentle sweating. Combined with Bai, Bian, Dou, Hou, Pu, and resolve the damp, cold from middle jiao, regulate the qi, and Jing Yin Hua Nian Qiao resolve the summer heat. So any kind of pathogen attack in the journals under the influence of summer heat, you don't have this slice. Everybody else have this slice? Oh. Okay, I'll send this to your guys. Why you don't have this slice? Or maybe I added something in many years ago. I'm sorry for this one. Okay, but never mind. We can understand this herbal pair very easy. Yes, I'll send information for you. And just 1 minute. I have another. Okay, any difficult for understanding this slice? So this is slice 1. I'll get my. I'll send in during the break, which is better for the time management. Now, do you have this slice? 后铺相连汤? No. All right. Okay. What we do is, and because you don't have this slice, I'll send you during the break. What I could do is we are going just focus on herbal pairs, try to review some herbs we learned in the past. Or I'll send it now. I think I can get very quickly. Have another, just 1 more minute. Okay, sorry. My action's so slow in the computer. I'm sending now through my other computer. Luckily, I have 2 computers. This is the week 3, yes? Week 3. So it's bad. Attached file. Okay, sorry, I should check the files first in the Blackboard before we do this. It's my fault. I'm too confident, self-confident, did not aware the things changed, the life changed for so long. So now we go to week 3. I give you concept 1 first, and okay, just send it out. Now give the concept 1 first, and we will see what's happening for the other concept. Can you find it now? Concept 1, week 3. Anybody checked it now? Okay, good. I'll check the concept 2 after. I'll check that later if anything else is. So I must update it in many years ago. That's why I did not check that again. I try to focus on additional exercise. I find the information in the Blackboard is already have plenty sufficient. Now the reason at that stage I added the additional one because so many formulas we can use for the Wenbing, and also they have so many different herbal pairs presented in the additional formula, so we can review that to consolidate learning in the internal med. So this is for damp heat and trapped in the surface, still in the surface, correlate with some damp and present in middle jiao, digestion tracts. So that's why they have distension, thorniness in the digestive systems. And instead of using sanjiao, yin san, they are not enough. Here they're using Hou Pu Xia Ling Tang. So this is basically by checking highlighted underscored herbs, 半夏、杏仁、一薏仁、白豆蔻、淡豆豉、后朴 with additional 藿香. This is used for summer heat. In the summer season with wind cold attack, 猪苓 as a kind of combination can manage the mixed cold, damp, heat, and achieve stagnation simultaneously. Because in the summer season or for damp heat pathogen attack, usually they never had a singular damp, singular heat, singular and cold happening. They're usually mixed. And for us have refrigerators at home, we eat a lot of salad, eat lots of cold food, and this is quite easier for us to have mixed pathogens internally. So that means I go this very brief. I'm not go through details for this one, as it's too much additional more than original one. Here just tells you they have different formula, such as sang xing tang, and dealing with specific exterior releasing, and also with internal dryness related with Wenbing. Wenbing, no matter heat pathogen dominated or damp heat simultaneously affect the bodies, eventually they're going to have some insufficiency or dryness will affect the bodies. So this Sanxing Tang will deal with both exterior and the dryness, exterior pathogen attack with heat and possible some dryness involved simultaneously. We can choose in Sanxing Tang. And this formula only composed with gentle formula. Li Pi is a pair of the pair. Sorry, Li Pi is a pair of the pair. Pair of the pair. Thank you. And this whole formula you can see very gentle, and even individual herbs have very smaller dosages, so usually used in the southern part of China. So around the Wenbing developing season, this is quite commonly used. For this one, we may have that in the original slides, and still with very, very gentle heat affecting qi levels, does not have a serious complaint, and they may have a fever, slightly thirsty, insomnia. If it's due to virus infections from modern understanding, if you have a good constitution, can resolve very quickly if you don't have a cough. But if it's due to bacterial infections, it's have a different damp will be presented very, very soon. But more irritability, disturbing the mind, cause insomnia is the main concern. So 梔子池塘, and it's quite commonly used. 梔子is the gardenia seeds, cleared heat from triple burner. And 淡豆豉 is diuretic and cold one. So both of these herbs, sorry, 栀子 is more colder, 淡豆豉 could be very dehydrating herbs. But both 1:1 ratio, you may learn this from the classics one. So this is good, can have a try. But the 白虎汤 is quite commonly used for heat in the qi level with big 4. Big fever, big sweating, big thirsty, big rapid surgeon and pulses. If they have a cough, at the same time shows 白虎汤 syndromes, you can consider using this modified word, 麻黄汤, 麻杏石甘汤, 麻黄杏仁石膏甘草. So this is good for early stage pneumonia-like conditions with big 4 conditions at the same time, and cough very severe, may have rusty and pink color of sputums. 黄芩汤 may be in your original slides, maybe not. So no matter what, I just want to mention this is very, very useful formula in the clinic. 黄芩、白芍、炙甘草、大枣. You see this herbal pair, maybe different formula, but basically 黄芩 is good to clear the heat. At the same time, combine 白芍、炙甘草、大枣 to supply the yin or look after possible damage to the yin or body fluid. So this can help clear the heat during the fire and also can look after yin substances in a fire or heat dominant conditions. Very, very good formula. And even used in modern life, you find you get so anxious with very rarely dehydrated tongue body. You can make infusion using very gentle herbs, herbal tea to help manage this kind of anxious heat related with dehydrations. So by doing a lot of project, lots of assignment, so many deadlines, you find so dehydrated, working so much in front of the computer, your tongue getting red, disturbing your affect the sleep, making more anxious. At the same time, you constantly want drinking liquid. So this is a good formula. You can have a try. 文胆汤, we know this formula long time ago. This is a modified 二陈汤. This is mainly deal with the bodies have a cough. Shanghai is more common than Wenbi in Melbourne. Yes, in a way, in winter. But in summer, if the virus has been so dominated at this stage, Wenbi will be much more effective to deal with certain conditions. Now, Wendan Tang is also very useful formula to deal with flame heat conditions with some mild disturbing, or we call the gallbladder heat involved with them. So this formula we learned many years ago. So if you may have wax and wane of chills and fever, so it tells us some level of Shaoyang has been involved, and at the same time they have distensions in the chest abdomen. It's good formula, resolved flame heat. Shows on the tongue. And with the zhuuru, it's very good ingredients to clear the heat, not just resolved damp heat, clear the heat damp, also can help calming the mind to attribute that heart channel. And other ingredients are much more warmer. So 半夏、陈皮、生姜、大枣 is much more warmer, and Fu Ling's diuretic and strengthens spleen. And 子时 was supporting the zhuuru to resolve excessive pathogens, at the same time to have descending nature, supporting Fu Ling, descending the qi dynamics. Another harmonizing is Hao Qing Qing Tan Tang. So this is another very important formula for the exam and for your future practice. By looking at these two specific herbal pair, Qing Hao and Huang Qing are wonderful herbal pair to help to vent the heat from the Shaoyang, or trapped between exterior and interior. So if you feel yourself never feel well, never feel uncomfortable, sometimes feel sticky inside the mouth, sometimes feel a bit warming, sometimes feel a bit cooling, but never ever feverish, just feel a bit warm and hot in a way. And this is very good herbal pair to help you to allow the trapped pathogens out through the through the sanjiao, through the saoyang, with additional 足、乳、止、咳、陈皮、半夏、赤茯苓 and 碧玉散. 碧玉散 they containing 清代、滑石、甘草. So this help to enhance clear the damp heat through the urinations. And overall, very good to clear the damp heat in the Shaoyang division or in the gallbladder. So that's how he mentioned a gallbladder. This is a very good formula in your future practice. Deal with the people never feel good, but when they go to clinic, have the medical checkup, never find blood test abnormal, X-ray abnormal, everything still in borderline, but they just don't feel very well. They may have very, very thick, greasy tongue coating or yellowish, may feel a bit sick when you eat something, disagree with the stomach, just feel something funny. But of course, physically do not have strong gallbladder functions. 碧玉散 is a modified 六一散 with additional 清代. If you have your gallbladder removed, you have a weak ability to perform to supporting digestions. Yes, you could have similar conditions like a pathogen trapped in the Shaoyang divisions. If you have present similar symptoms, yes. And another harmonizing, trying to bring them out from the membrane cells. Now, this is a very important part in Wenbing. If these have not covered in your original file, you need to read it a little bit if you're choosing any topic related with damp heat pattern dominated, because this specific 木元 concept 木元 or sanjiao, some of the explanation for sanjiao is focused on memory sources. Damp heat is very easy, or damp is very easy trapped in these kind of areas because they are not very easy to be eliminated out of the systems. So if you feel alternating or change wax and wind, chills, fever, so this typical Shaoyang division has been affected, or Mu Yuan has been affected, and at the same time feel distension in the chest, a lot of indigestion concern in the regions. So all the mixed up damp heat in the bodies, you can consider using this kind of formula. Details I'll leave you for self-reading. If it's relevant to your assignment, to a topic, you can have a look. We are going to discuss a little bit membrane sources later. By checking all the details ingredients, you can find a lot of aromatic herbs used together in conjunctions with huangqing and binglang, etc. And houpu is very commonly used for these kind of situations. I think we have wrong spelling. This I'll check again. It's a huangqing or huangqi. Should not have a huangqi here. Should have a huangqing. I'll check this one again for the original one. Lian Puying is also another damp heat resolving formula. Very good to dry up the damp and clear the heat, leach out these kind of pathogens through the system, with combination Huangnian Houpu as a special herbal pair, and supported by second herbal pair 栀子蛋豆豉. We know this is 栀子豆豉, 栀子豉汤 by itself. And with additional 菖蒲半夏, we know this help clear the orifice and trapped by the damp, and Lugan to supply the yin. So this tells you mixed, mingled damp heat in the body. You have bitter taste complaint, yellow greasy tongue coating, and distension, fullness in the digestion tract, maybe nausea, vomiting involved. This is good combinations to construct formulas. If you ask me a question, do I memorize all of this one? At the moment, you don't need to worry. You just need to try to understanding why this kind of herbs has been presented within this kind of formula. That's it. Before exams, if we need exams, requires exam, I'll give you a list of formulas later. Next formula have to be presented in your original information. 三仁汤, 3 kernel decoction, which used specific focus on the dampness and trapped in the system, at the same time with chi obstructions. People present as fevers, which is getting worse in the late afternoon. They may have still the fever cannot resolve after a little bit of sweating. And this sweating usually quite sticky, and body have very strong unpleasant odors, smells. They have slightly chills feelings. They may feel distension, fullness in the chest or epigastric regions. Urine can be scanty, and the tongues shows a sticky, very white, greasy tongue coating. So cool to damp dominated with some level of heat. So that's why you can see 3 kernel, 杏仁白豆蔻 kernel with additional 薏仁 3 kernel. So the colored maroon colors, the 3 kernel manage up, middle, and lower jiao damp. 杏仁 look up upper jiao damp flame. 白豆蔻 look up middle jiao damp cold. 薏仁 look up the lower jiao damp through the urinations. And 后铺半夏 warming aromatic and help transformations. 通草淡竹叶华是 diuretics. So they're all focusing up, middle, lower jiao and simultaneously. This is a very popular formula practiced in women beings clinical applications, especially people show all the upper, middle, lower jiao have some level damp or flame. And this formula again focuses on specific damp heat, but it's damp dominated conditions, and muddled with the body shows a lot of nausea, vomiting, loose stool with no desire to eating or drinking, poor appetite, congestion in the body. It just feels whole body has been mixed, she has been sticked up with something else. You're not able to stretch, your whole body feel heavy and stuffy. So this is possible formula, and you can use that. If you find this is too much, you can leave for later, and otherwise read details of the information such as 藿香佩兰, very good herbal pears. It's all grown in the summer. They can be used by itself to make a tea to drink, resolve the damp cold trapped in the body, either in the surface or in the middle jiao, to waken up spleens to improve the appetite. With additional 陈皮半夏, modified 二陈汤 is easy, help focus rain or damp. With 大腹皮, regulate the qi, and 后铺, regulate the qi, transform damp and flame, and 鲜 refreshed 荷叶 and lily leaf. This is also diuretic and aromatic and regulate the qi. And again, here have 藿香 aromatic mint to help resolve the damp trapped in the body and give you very gentle perspiration in the summer. 茯苓 diuretic, 后铺 aromatic, also tangerine skin. They help regulate the qi, resolve the damp together. 杏仁花 should help resolve the damp flame up and the lower jiao. So these just give you different example of herbal and combinations presented on the name of this kind of formula. That's it. And 茯苓皮汤 focus on the damp and trapped in the superficial, and they help enhance urinations by using a lot of diuretic herbs inside. And 针叶承气汤. Any of you still familiar with 针叶汤 and the 承气汤? We learned in a formula many years ago in second year of the school. And this is focus on body fluid deficiency, lack of nourishment resulting of constipation. So you major 承气汤 2 ingredients, 大黄 and 芒硝 to purge, to clear the heat, soften hardness, with additional Sheng Mai San Di Huang to clear the heat, nourish yin, and soft hardness. Result much more effect a great of bowel movement, more sufficient and clear bowel movement. So this formula is from previous learning of formula study, and this is also additional and consolidating learning for the classics 1 or 承气当 formula. So you have to be able to understanding this pattern very, very well. So have ink deficiency, also have constipation, have unresolved of heat. This is simple. When a yang ming organ has been obstructed, that means heat is very, very exuberance without body fluid deficiency. And that's why heat has been trapped with qi together in the yang ming fu organs. So usually you can feel some obstructions in your descending glands. You may feel pain or distensions, or you may just suffering very difficult dry stool or no bowel movement. So this is good formula. 大承气汤 and 调味承气汤 will be utilized. So what different things is, if there's no deficiency with hard stool, pain or distension and fever, 大承气汤 is good formula. But if you also have weakness of qi and difficult to push or perform the physical strength to perform, using 调味承气汤. So ingredients difference. The difference in ingredients, you should be able to work it out by now. So they're all containing da huang inside of these formulas. And here comes a kind of formula called 子时导致丸. By checking this name, 子时 is very important ingredients here to regulate the qi, 导致 to remove the obstructions. So this more deal with obstructions in the colon or maybe the whole digestion tract involved with indigestions and constipations. And we use this one to help to remove food contained in the digestion tract and the poos and switch in the lower region of digestion parts as well. So using 子时大黄 to remove obstructions in the end of the digestion tract, using Shen qu to resolve food stagnation in the stomachs. And Fuling diuretic also strengthens the spleen. Huang qing huangnian resolve congestion heat due to food retention. And Baizhu supporting the Fuling to strengthen qi. And Zexie also can supporting Fuling in a way to clear the heat through different exits. So the basic clear the heat from both urination and the bowel movement. At the same time, it's a bitter cold huang qing huang nian and resolve congesting food cause of the heat in the middle jiao. So if the people have very bad body odor, when they're talking to you, you can see the mouths emitted very, very strong, unpleasant, foul smells, and also suffering bloating stomachs, constipation, and this is good formula to have a go for them. When the bowel has been opened, do not keep using this one, because what? You can see the ratio of the da huang is huge. If you overindulge in this formula, it can cause some serious damage for the spleen's qi. Another purging formula, purging patterns, is Tao Ren or Tao He Chen Qi Tang. So again, from the Chen Qi Tang families. So they still have this formula should be discussed in the gynae study. They have Huang, Da Huang, they have Mang Xiao. That's why they followed into the Chen Qi Tang family with additional Tao Ren and Gui Zhi resolve the blood stagnation and remove stasis and enhance the blood flowing in the systems, and Zhi Gan Cao modified herbal natures. This formula used quite a lot for gynae, people suffering period pain, or people have troubles in the uterus, have abnormal growth and blood stasis, or just people have the person trapped in the lower jiaos, suffering fever and hard painful distension in the lower abdomen, and also dried constipations or difficult struggling bowel movement, especially the tongue shows the purple patches or very dark deep red color, sublingual veins, and enlarged or excessive veins. You can use this one, help them to resolve the symptoms. But if you already have the fibroids, multiple fibroids growing in the uterus, they're going to help you reduce that. For some, depends on location of fibroids. For some, can help reduce the blood supply and reduce blood stasis and reduce the size, but for the others, doesn't. But this is good. Have a try to introduce this formula to help to remove blood stasis and also control the constipations. This formula also can use for people suffering the period of pain related blood stasis associated with constipations as well. Very useful formula clinically. And Qing Yin Tao, you know this formula since the formula study. And this formula basically used for the heat in the nutritive level, and that does containing ingredients exact same in the Zhenye Tao with additional buffalo horn as a substitute. It can help to clear the heat in the nutritive level without damage the yin. This also can soften hardness, supply the yin, with additional Jing Yin Hua and Nian Qiao, aromatic, bitter, cooling one, and this clear the heat in qi level and also soft hardness. Huang Nian can clear the heat and also calming the mind. The cooling the blood, disperse blood stasis, I'll leave you for self-study. And this is a simple formula, but this, if any patient have this kind of condition, usually they end up in the hospital. They'll go see their family doctors, go to the emergency, and they're not going to waiting to see us because it's quite severe. But they do not have a high temperature at the time. They have these kind of skin conditions come through, still quite scary because they can become huge patches of this kind of maculas presenting on the body, and patches all over. Looks like they had been punched by somebody, but that kind of bruises is different than the spoon and the cupping. It's completely different. All the bleedings underneath the skin comes out, some black color, some fresh red. Very, very scary. Next is open orifice. We don't have a chance to these kind of clients, but if we do have cases to see something similar in the non-fever seasons or non-fever stages, you can see Shi Cang Pu, Yan Qiao, Yu Jing are great combination to what? To open orifice. Or if people suffering what? Dementia, like people have dementia, or dementia like for old people, you can mimic or utilize similar strategies to help them, especially when old people have dementias, have just very difficult with the memories. There are lots of phlegm in the throat. You can hear sounds in the throat during the sleep, or they're just so flaming, complaints of flaming throat, even the cough. You can utilize exactly similar strategies to deal with it, either using aromatic to resolve this kind of damp from upper gel and combine it with diuretic here, gentle one, to clear this kind of damp through the urinations. So this is a good strategy you can adapt for dementia or some treatment later on if you want to focus on elderly people's illness. When the convulsion happened during the Wenbing suffering, a lot of internal wind were presented due to persistent high temperatures. So muscle twitches were occurred, injury were occurred, and this is quite a common formula used. Egg yolk is very important in a way to help manage to supply the jing or yin essence, combined with all these ingredients here to support the yin or blood components to manage manage wind symptoms. And overall, this formula is good to dealing with, even using a similar formula, deal with the later stage of people after the chemotherapy, radiotherapy. So cancer suffering patient, they do not have typical internal wind, but they have serious insufficiency with residue of the heat. You can adapt some of these kind of herbs to manage it, because Shen Di Huang is very good to what? Together with Mai Men Zhong to deal with the residue of the heat related to chemo and radiotherapy. All the rest can help supply the yin, nourish yin. If people are vegetarian, vegan, you just need avoiding these kind of ingredients. The others still can be very beneficial to help supply the yin. But if they are not vegetarian, and these three very good ones containing specific chemical components from modern research can be beneficial to supply the yin, help them recover the yin much more quickly. So the reason these formulas here. Next formula is focused on yin supplement in the later stage of Wenbing. So because the heat is dominant, very easy injury yin. So Sa Sheng Mai Men Dong Tang could be used to consolidate the yin in the later stage when the yin has been injured after suffering heat dominant condition. So Sa Sheng Mai Dong, you should familiar with these herbs for many years now. It's good to clear the heat and supply the yin. Yu Zu can also clear heat, supply the yin. Shang Ye, they can help very gently vent the gentle heat out through gentle dispersing actions. Tian Hua Fen, they can clear the heat, supply the yin. Bian Dou, supporting spleens qi. And Shen Gan Cao, modified herbal natures, and also can supporting and gentle Sang Ye to clear the very mild residue of the heat in the later stage as well. Sheng Mai San, 人参脉冬五味子. These formula have so many clinical applications, have great values in modern practice. They can use for people who have no serious illness, just use it in summer to supply the yin and supply the qi. Or for people already suffering irregular pulses and heart conditions or lung condition in the past, present with yin and qi deficiency, you can use this as a kind of tea, drinking regularly as a maintenance. Or if they already have qi and yin deficiency after Wenbing attack, you can use this formula as a kind of consolidations later on, especially when people have scanty tongue coating or mirror tongue coating and the bit heat residue remaining, using this formula. If the heat still quite noticeable, you can add it Sheng Gan Cao, which is great, and also make the whole overall flavor is easy to be accepted. Sheng Gan Cao can clear the heat. Gentle Sheng Gan Cao can help clear the heat, but overdosing using for long times can cause harm for the liver organs, and could also have interference with some medications, can affect some diuretic drugs as well. So do be careful about any kind of drug interactions. How long is too long? There's never have a fixed exact number for too long. So basically, if it's necessary for you when symptoms well managed, and don't use that anymore and apply the diet therapy. So all the treatment, even gentle herbal treatment, only treating the symptoms, recovered up to 90% and leaving 10% for diet therapy. If it's very severe conditions, use very harsh, strong herbs. We're treating the conditions when symptoms and recovered up to 60% using gentle herbs. Contraindications. Everything have their negative, positive perspectives in a life. Even sugar can cause harm, and water can kill the life. Same for the herbs. So here have notes. Careful with pungent and warming herbs. Overindulgent pungent and warm will what? Will causing excessive body fluid leakage from profuse sweating, causing serious dehydration, such as spicy dishes you eat every day. You can have constipations and skin rashes, ulcerations. Carefully using diuretic herbs. Overindulgent diuretic can damage kidney organs, can cause dehydration. Carefully with yin tonified herbs. Too much yin tonified can clog the digestions and result in too much of yang damage. Carefully with bitter and cooling herbs because they are very dry and very cold. Dry can damage the yin, cold can damage the yang. So just to be reasonable when we're using this group of formula. Now you can see I've been going through very briefly. That means at the moment we just need able to understanding these kind of herbal combinations. And if you find this kind of herbal combination still challenge, and do spend some time review the herbal material and the formulas. Now, here, let's have a look, review about quality of the tongue And on the tongue played the role played in Wenbing differential diagnosis. Like I mentioned in the welcome message, the tongue differential diagnosis and on the skin rashes differential diagnosis are much more important in Wenbing compared with post-diagnosis in Shanhanlun. So tongue here, what we need to look. So here's is slides focus on the coating of the tongue. So one is the color, moisture, and thickness of tongue coatings. Once you can see through the color of the tongue coating, that means the tongue coating is not thick. Once you call that thick tongue coating is, you cannot see through the color of the tongue, and that kind of coating is a thick. Otherwise, if they still have coating present, you call the thin tongue coating. So what means no non-tongue coating or missing tongue coating? So basically, you can see barely the raw body of the tongue, that is non-tongue coating. Even they still have very thin and transparent coating, they still call it coating, just very thin tongue coating. Moisture, so which is compared with if they're dry or not. Color, they can be pink, pale, and dull purple, or black, or white. And depends the color presented, how we interpret it. Once you can see any redness, never ever see that pale. You can see the pink pale or pale pale. If the pale is no red color you can see at all. Once you still can see redness, but the towards the pale, you say pink pale or pale pink. So just be careful about the interpretation because they can lead into complete different principle, diagnosis, principle treatment. So here, generally, color changes from white to yellow means of what? Means of passage from wee level to chi level. Excellent. So that means for white tongue coating, and they usually have no correlations with heat in the chi level at all. Once the heat reaches to chi level, tongue coating have to have some color changes. And from the white to yellow or brown to black shows a deepness of progression. So more severe penetration of pathogens in Wenbing, much more colorful of tongue coat will be presented. More possible correlated severe ink deficiency will be also presented as well. Moisture reflect fluid and levels of fluid injuries. So dry coating shows more dehydration and more insufficient yin. And thickness of indicated early stage of tongue coating or early stage of Wenbing in a way. We know that from the foundational diagnostic. So this typical image to identify different thin tongue coating and thick tongue coating. So which one is thick tongue coating and which we cannot see through the color of the tongue body? Is it number 1 or number 2? Which one is thick tongue coating? So everybody know that from this one. Excellent. Wonderful. So by looking at tongue coating color, you can see the first tongue body, and the tongue has not turned to yellow yet. So if they do has been suffering Wenbing, they could be still in the wee level, but if temperature so high with no chills, they could have both wee and the chi level has been affected simultaneously because lip of the body is too red. If they do not have lipsticks has been covered, the lip colors here is too red. So this usually represent very, very high temperatures. Usually go to chi level already, but based on tongue color here hasn't. So if both of these changes at the same times, you could have both wee and the chi level has been affected simultaneously. But second one is horrible. This is typically problem goes beyond wee levels or maybe go to internal organs because whole tongue color and base of the tongue color is white and covered on top, especially on the bottom here, very old yellowish. So either they're smoker or they have a lot of damp heat in lower jiao. If the tongue coating present like this, they're not just dampness internally, they always correlate with fluid injury at the same time. So very, very dry. Okay, again, so what this tongue tells us here? It is yellow. Is that symmetrical distributions or not? It's a damp. Yep, it is very greasy. Wonderful. It's very greasy. It's yellow. So damp heat. Any indeficiency correlated with this damp heat yet? Can you see the tongue coating? Are they evenly distributed or not? Yes, there's uneven, wonderful, and some part you can find missing tongue coating. One is big patches here, one has a little bit of crack here, tiny one, some patches here. So some level of indeficiency is already present different level. So definitely it's a damp heat internally and already injured bodies in. And you can say furry tongue coating. Furry tongue coating is greasy tongue coating. It's the same thing. And this is typical, and tongue coating indicated in the middle jiao has been affected. Now, why they call the V level also involved? Because the color of the tongue, not as red as the qi level of the tongue body. So that means the heat in the qi level is not severe. Some part is still hanging around the qi level in the V levels. So that's why this is a combination. We combine both tongue coating and the tongue bodies here. Gray color of tongue, progressive to the black color, and qi level mainly. And this gray color is due to dehydrations and also due to fungi infections or floral disturbance in the gut. So dry tongue coatings in the qi level, injured body fluid, and green tongue coating qi level, flame damp stagnations. I'm going to have to give you a tongue coating later. No, tongue image later, sorry, not tongue coating. So this is much more severe greasy tongue coat, more severe greasy yellow tongue coating that can turn into the gray or black. And any kind of gray or black tongue coating indicate the fungi has been dominated breeding in your digestive systems. Have a look at this one, beautiful. So this is more severe damp heat has been trapped in the middle jiao. So all your digestion systems, flora gut has been very bad disturbed. Normal bacteria or normal flora has been interfered. Instead, fungi is very happily and blossom there. That's why your tongue coat becomes so unpleasant color. Looks like painted with coffee, yeah, coffee powder maybe. So this is a very dehydrated one, shows the condition in the qi level, injuries body fluid, and this had very severe heat in lower jiao combined with both damp heat. That's how the result is kind of so dark and greasy tongue coating. There's questions. Could you please slow down a little bit? Sorry. Okay. Now, I saw this as a revision for the tongue diagnosis. Everybody familiar from the diagnosis. So this is typical, more severe damp heat conditions with heat exuberant in the lower jiao. And that's why we have black, greasy tongue coat can be presented. With uneven distribution of tongue coating, you can see middle part is completely no tongue coating. We know they have indeficiency already presented. And with this way of stretch of tongue, because I believe this person is very, very old, have a look these wrinkles around the up lips here. So that means whole body dehydration is very commonly understanding. So we just tried focusing on the tongue colors here, tongue coating colors here. It's a black and it's more severe heat and the damp together with severe indeficiency. They could represent it for the heat in the yin level or blood level, could represent it for the heat in the qi and yin level, or could represent with damp heat only in the qi level. Depends on your constitution, depends on your precursor of digestion functions. Tongue body reflects the heart. Tongue is a surplus of the heart. If you're born with very tiny tongue, like little tongue present for the snake, what's that mean? That means you have constitutional gene deficiency, heart yin or kidney gene deficiency, yes. But if you find your tongue is so big, a heart can fit it into your mouth, so that means so swollen, so that means you have qi deficiency or have inclinations of basic dampness body types. Once you have a snake-like tiny, smaller tongue, you are much more inclined to have yin or blood or gene deficiency. But if it's happened after serious high fever-related conditions happening, that means you have very serious dehydrations, resulting tongue shrink. How does a giant tongue indicate the deficiency? Good. Bigger tongue compared with smaller tongue. Smaller size of tongue have inclinations correlate with indeficiency. So this is more indeficiency correlate with smaller tongue compared with body size and human body size digits. Big swollen big tongue correlates with qi or yin deficiency because the size of the body tongue correlates with yin essence of the heart. So if you have a smaller tongue, you have a smaller jing or big jing. You have big tongue, you have big jing. So that means you have big jing in a way. It's very easy to have qi deficiencies. It requires a lot of qi to manage this kind of jing. So same for this one. So relatively, but not absolutely. This is relatively. So color changes important to identify yin and the blood levels patterns and blood circulations. So if you have paler color, so they don't have heat in the blood. If you have red colors of the tongue, you have heat in the blood. And if more severe red, more severe heat in the deep level regarding to 4-level differential diagnosis in general. Have a look at this image. This does not have sufficient tongue coating because you can see naked. You can see everything presented of tongue body as a kind of exposed all these internal structures in front of you. They have very deep cracks in the middle, have a lot of numerous tiny cracks all over around the edge or on the body. So this is very, very severe yin deficiency causes these multiple cracks. If people were born with this kind of middle cracks, you know people have constant what kind of imbalance? If you were born with this kind of deep cracks, indicated imbalance between heart fire and kidney water. So the patient or the person inclined to have anxiety and easily stress. And they're very sensitive to perceive any kind of interference energies in the surroundings. And very easy have disturbing sleep, very disturbing personalities in a way, and very easy interfered. They could be very, very intelligent, very creative, because they perceive energy surrounding. If they can mingle the energies with the universe they're living, and they can be very, very creative, very artistic oriented. But physically, and very hard for them to achieve very good strength. But if it happened after women suffering, we know it's very severe injury through the high temperatures. The one in the middle. The one in the middle, we call that hard line. You learn them the tongue diagnosis, I believe. So one in the middle. Now, for heat in the Wei level and the Qi level, you should not be able to see this kind of tongue body unless people were constitutionally weak and have imbalance between heart and the kidney. So they were born with this, or have typically B groups vitamin deficiency from improper dietary conditions. They could have similar conditions like this kind of tongue. But when the heat affects the Wei Qi, or above the Wei Qi, go to Yin and the Qi, blood level, this kind of tongue presentation is quite common. But when the heat go to the Yin and blood level, they have no more tongue coating presented. And there's questions, have the understanding that it's a more stomach ink deficiency, but okay. If there's no tongue coating, it's typical stomach qi deficiency. Tongue coating represents stomach's qi. Because there's no more coating present in this image, is typical stomach's qi deficiency or injury. Up to this stage of the tongue after wombing, they usually don't have good appetite. They requires a lot of slow maintenance to recover their digestions. Having looked this kind of tongue body, when the heart ink is deficient, kidney is deficient, liver ink is deficient, does the stomach qi still normal? The whole body is depleted. All the yin, all the substance body fluid has been depleted. Thank you. So you can see this cover how many range? Upper jiao, middle jiao, and the lower jiao. Yes? Yes, it is ink deficiency if it's no tongue coating. But the coating represented by stomach's qi or represented with appetite. Once people suffering high temperatures, whole tongue coating has been diminished. Do you think appetite still be strong, able to enjoy eating the steaks and enjoy eating food? Appetite will be diminished at the same time. So stomach's qi and represent progressions of any kind of illness. If you still have normal, very thin tongue coating covered, you have very good progressions for the illness, have a hope for the life. If no more appetite or no more normal tongue coating presented on the bodies, progression for all the illness is usually will be not very positive. Now, any question for these slides? We'll have more tongue images discussed today. Okay, have a look at this one. Does this look more severe than previous one? Why yes? Because of what? Have you ever tried to buy the kidney of the cow? You can see all these horribly cracked, looks like cutting, has been presented around the edge of the tongue, as well as very deep crack in the middle. Looks like somebody put a knife there, did some tortures for the person. Yes? So if you have had the chance, go to butcher to see the kidney cow, that can remind you similar of this kind of tongue image. Very scary. So many separate segments related with the kidney of the cow, but this human tongue, if they present like this, very serious heat, exuberant heat has been and spreading around all over the body from up, middle, low, from Wei, Qi, Yin level, causing serious damage. And because the tongue, you still can see very mild white tongue color. So that's a tongue coating. Thank you. Very thin tongue coating, but very severe in damage. Here they say no tongue coating, which is not correct. You still can see very light white tongue coating. So I'm disagree with this because you still can see white thin color covered in the surface of the tongue. But it's very severe and yin deficiency. They could present it in the nutritive level during Wenbing suffering, but with the color of this kind of tongue, usually presented in the recovering stage or later stage Wenbing, because the color of the tongue is not as a bright, not as a purple, so it looks like something already finished the forest fire, already finished the burn, is left behind. There's a question, is that a dark patches of cold at the tip? It's a little bit purple. There's slight purple. It's like purple here. A little bit purple here. So they may have blood stagnations based on color of the lips. Any of you can see the lips. So it's not younger people. It's very old people. So for old people, cardio system is not strong enough. So it's possible heart is not strong enough as well. That can causing when the fluid has serious damage, you have very more condensed and cells flowing in the bloodstream. Very easy to have stagnations. Very serious heat trapped internally. Yes. Have a look this tongue. If the human present a tongue like that, what that means? That means very flaccid, good. This is a typical qi deficiency tongue, like the image we reviewed at the beginning of the session. This is extremely too long, too flaccid, poor muscle tone represented tongue color, a tongue body. The color is a bit purple. So overall, it's qi deficiency with some poor blood stagnations. Now, this, if they present for the bodies, purple tongue bodies, and there's extremely heated, maybe related with toxicity, they could represent a yin and blood level regarding to Wenbing, could also relate with some level of blood stagnation because of purple color. And if human have this kind of long stretch out of the tongue, a bit scary. And have a look the next one. Have a look this one. Does this tongue look a bit stiff for you and also deviated? Deviated. Now, previous tongue is scaring. The dog's tongue is a bit scary because too long, too flaccid. It bit scary. Looks like it can dropping off, be diminished. So this tongue now is deviated, looks a bit stiff, and deviated to the left with yellow greasy tongue coating, and the tongue color is not red. So the tongue's a bit stiff, not flexible, so they may have a stroke, may already have a stroke. And be careful when the patient have this kind of tongue and slightly swollen and enlarged. They definitely have stagnations, have both qi stagnation and heat stagnations. Now, any of you see this? Can you see the dent here on the side? Can you see that? Can you see the dent here? Yeah. Oh, I can't show that one. We all can see. Good. So this may correlate with the liver yin deficiency. So do be careful. If this is represented with a dent here, because more close to the edge of the tongue here, may have severe liver yin deficiency if they have been go through the Wenbing high temperature related sufferings. And teeth and gums. Teeth and gums also very important image, can be used to supporting the diagnosis in the Wenbing clinically. So, and while we check in the tongue, we can check in the gum and the teeth at the same times. And we are not dentists, we don't have a specific tool can check in the teeth specifically, but depends your ability of observations. So go very quick, very brief, and that can help you go through that. And focus on the basic, the color of the teeth when people have suffered very high temperatures and some shining pieces of the teeth become much more dull color. That's a typical yin deficiency due to high temperatures. But if it's caused by some antibiotics taken in the past, that's a different issues. If the moisture of the teeth or color presented teeth have serious changes, we call that kidney yin, kidney jing has been seriously affected very badly because teeth correspond to kidney jing or kidney yin essence. And jaundice or luster, so stomach's yin, could also be affected if the change in the gum. And jaundice without luster, exhaustion of kidney yin, and bleeding gums usually relate to stomach heat. So if any of the clients, you can see they have very poor gum conditions with swollen red, very easy bleeding, usually they have lots of stomach heat and correlated with big appetite, prefer eating animal protein, drinking alcohol. In order to resolve these kind of gum conditions, very important, minimize spicy food, animal proteins, and reduce alcohol drinkings. But regarding the Wenbing conditions, we can using the purgative method and improve the bowel movement to manage gum lesions, inflammation, swellings. Because gum is governed by what channel? Stomach. Thank you. So that's why gum corresponds to stomachs. But when the gum becomes deficient, shrink or receding, as well as kidney. So gum have a funny thing. Excessive, we look after kidney or look after stomach. If the deficiency, we support the kidney. But for the teeth, always checking the kidney. And up and the lower gums have different channel attributions. Yes, that's true. But it's all Yangming. No matter up or low, all Yangming. From the Yangming divisions, doesn't matter, large intestines or stomachs, all Yangming regions. All the Yangming heat can be resolved through the proper bowel movement. Thank you. That's very good questions. Now we are up to the time for the middle session